So thank you everyone for coming to listen to all the talks today. My name's Christian Buckland. I'm a psychotherapist with a specialist interest in eating disorders. I've previously worked in the NHS eating disorder service and currently run a private clinic. I'm the professional advisor to a national eating disorder charity, and I love working with this client group. I work with them on a daily basis. So before I get into the talk, I'd like to say I really enjoy working with them. So it's a delight to be talking on eating disorders today. And some of my observations are going to come from what I've witnessed inside my consulting room. So following on from some of the other presentations today, what I thought I'd like to speak about is the impact of the Covid-19 restrictions, as well as the manner that Covid-19 was discussed and dealt with by the government and by the media, and how this impacted those people with mental health issues, in particular, those with eating disorders. I will show how there was an increase in risk factors, as well as a decrease in protective factors for people suffering with eating disorders, which we know means, unfortunately, we're going to continue to see an ongoing rise in new presentations and an uptick in those who were in recovery and now seeking help again. So it isn't fully clear to what extent eating disorder sufferers were impacted by COVID on a physical level. For example, there are some studies suggesting that those with mild anorexia may have a resilience to viral infections due to an altered immune system, but those with low weight, very low weight, will probably be particularly vulnerable due to a compromised health. But what does feel more clear is that the government restrictions did disproportionately disadvantage those with eating disorders, which is why I want to spend some time looking at why they occurred. So in the future, we can hopefully make some decisions based on previous learnt experiences and some of the research we do in order to protect vulnerable groups such as those with eating disorders. We can just go to the next slide, please. Fab. So if we look back at early 2020, I remember the numerous reports of this new disease, and I remember thinking, I've never heard the word novel and unprecedented so many times in my life. And on reflection, I can see how the language being used sparked real levels of unease in me. There was a barrage from the media reporting of this new and unknown disease, including images of people dropping down dead in the streets, hospitals overflowing, and there was a constant comparison to the Spanish flu. Lots of people with mental health issues already have a higher baseline of anxiety, so these news reports disproportionately impacted them. And these topics became common themes inside my consulting room, with patients using words such as terrified and traumatic. And it also stirred up so many unresolved issues for a number of my patients, leading them to feel even more frightened. And unfortunately, the quest for knowledge is often a way of trying to reduce anxiety. So the more people were frightened, the more they were drawn to watching more and more news about the situation, creating a dangerous vicious cycle. So we saw the public in general were feeling frightened, and many mental health sufferers were feeling even more frightened. And when feeling scared, we often look to our parental figures for guidance and reassurance. So the public naturally tuned into the government briefings. Boris Johnson, who might be seen as the father figure, looked at times to be frightened and often gave conflicting messages, such as the UK was going to aim for herd immunity and then changing course. He also warned us that the NHS, who could be seen as the mother figure, was not going to cope, and we had to try and save her. So instead of gaining the reassurance the public were looking for, many were left feeling even more frightened with a sense of impending doom. Then we saw the introduction of new policies for dealing with pandemics that hadn't been used before, such as social distancing. And the government were concerned that the public would not welcome these new policies, so they turned and looked to their scientific advisors to try and identify ways to influence the public to adopt these desired behaviours. And one option provided was to increase the perceived level of personal threat amongst those who they deemed were complacent, using hard-hitting emotional messaging. The scientists did also warn the government that there could be negative repercussions for adopting this option. This option did not only impact those they deemed complacent, unfortunately, these tactics further exacerbated the already heightened levels of fear for many other groups as well. So what I'm trying to highlight is that the client group we're discussing today were already facing extremely high and unusual levels of fear before restrictions such as lockdown were introduced. So their risk levels were already raised. On top of this, the restrictions increase other risk factors and also reduce a number of protective factors for this vulnerable group, which is what I want to go and have a look at today. So if we can go to the next slide. Thanks. So taking a further look at the increased risk factors, we know there was a heightened sense of fear and anxiety for the majority of the eating disorder sufferers. We also saw that parts of the psychological work we do as clinicians became more difficult. For example, challenging unhelpful thinking patterns such as catastrophizing was less effective. Patients have become hypervigilant, absorbing scary data and regurgitating it in response to some of my psychological interventions. And unfortunately, I could often see exactly where they were coming from. So it was quite difficult to kind of try and challenge some of their thoughts. Black and white thinking became more and more common: safe, not safe, good, bad. And this thinking style was being promoted by some of the messaging in the media and the advice given. So the grey area was shrinking even more for my patients. And we all know lots of eating disorder thinking loves the black and white area. We also saw a promotion of only focusing on the negatives and discounting positives. We've never had a running death count before, and I don't recall much discussion on recovery rates. So patients were adopting this thinking style more and more in other aspects of their lives. I didn't have my breakfast this morning, so there's no point continuing with my meal plan. So I suppose what I'm trying to point out here was actually some of the work we do in the psychological field was actually becoming more difficult. We also saw the relationship to food for those with eating disorders become even more disturbed through a fear of contagion. I witnessed patients start to eliminate more foods from their diet than ever before for fear of coming into contact with the virus. There were reports of contamination occurring by touching shopping from the supermarket, and recommendations of leaving food out in the sunlight before bringing it into your home. Some sufferers did not want to try anything new. They didn't want anything new into the house, and this became a new challenge for many to overcome, enabled more food groups to be restricted based on things like packaging, texture, and other issues. And there was also an emphasis on healthy eating in order to combat the virus. Once again, giving more reasons for people to be eliminating more foods that they were deeming as bad. The shopping experience became more anxiety provoking. We know that many patients with eating disorders find supermarket shopping stressful for many reasons. Feelings of being overwhelmed by choice, being surrounded by too much food, the light, the sound, the amount of people. It's often a significant challenge. And once supermarket restrictions were in place, shopping was even more difficult. For example, the mask wearing for many sufferers, especially for those who had experienced any form of abuse, was difficult and for some impossible, but they didn't want to bring attention to themselves to continue to wear one, even though it brought on some physical reactions. The social distancing inside shops increased the feelings of worry and being out of control. And many patients stopped going to the shops altogether. And this had been an important part of their recovery. And interestingly, I also noticed a strong response to when shops were limiting the number of items people could buy. Many people told me how being confronted with not being allowed to buy things quite unbearable. And this was even higher in the group, sort of in the binge eating disorder group, especially people that had their sort of eating disorder roots in childhood where they didn't have access to food. So these restrictions were bringing up a lot of different feelings for a lot of different people. So the role of media, the media seemed to focus only on the negative, which is something we try to get our patients not to do. As I mentioned a second ago, I've never seen a disease carry an ongoing death tally reported in newspapers and on news channels before. So the public didn't get a break from the fear levels just being drip fed to them. In my kind of work, I kind of feel that it's like the patients were being drip fed a shot of adrenaline 24 hours a day. We saw routines being heavily restricted, and we often know that eating disorder sufferers, they need a routine, whether that's going for a walk, going to see a friend. simply going to appointments such as individual therapy or daycare. So routine can be so important, and this stopped suddenly. The phrase I heard more commonly in relation to this was, "I'm just stuck in my head all day." And this to me was a huge risk factor and led to increased feelings of isolation, loneliness, and a feeling that no one cared about them. Being in lockdown meant there was an over-reliance on social media, and we know there's a connection between social media usage and eating disorders. So this connection was significantly increased. People also turned to Dr. Google more and more for answers to COVID, which was turning up more and more symptoms, increasing their worries, more and more foods to eat or to avoid, again, decreasing food intake. And eating disorder sufferers were exposed to more and more food-related topics coming through online, as well as there being a push for getting fit whilst during lockdown, which increased the excessive use of exercise for many. So the changes in physical activities also increased the risks. I remember one patient saying, "I know I'm allowed to walk for 30 minutes a day, and that's it. But I don't know how many star jumps that equated to, so I just carried on." I also noticed there was a huge sense of failure, shame, worthlessness, and hopelessness experienced by eating disorder sufferers. There was so much attention being placed on what people had achieved during lockdown, talks of learning a new language, learning to bake or getting fit. Whereas for many eating disorder patients, just surviving was the objective, but this wasn't seen as an achievement. It's also important to remember that lots of patients felt they were already behind their peers due to spending time in treatment or through delays in development. And many reported they felt the gap between them and their peers increased due to lockdown. And finally, hopelessness. I can never say that word right. But this is one of my biggest red flags. And when it comes to risk factors for all mental health issues, it's something that I always feel is a red flag. And so for some of the other reasons we've just mentioned, many people struggling with food or weight started to feel even more hopeless about their future, which was a real risk. So if we can go on to the next slide, please, to look at the protective factors. Thank you. So we saw a worrying increase in risk factors, and unfortunately, we also saw an alarming reduction in protective factors. Support networks were reduced, and for many, it stopped. These networks have been crucial for many, and for this to stop was extremely concerning. Whereas we said, well, lots of groups are going online, so that'll be okay. Yes, that was fine for some, and they adapted easily to these online groups and sessions. But for those who are really unwell, this was really difficult to do. And just changing anything, especially in things like therapy, is huge. If I just move my chair in my room, some of my patients might comment and think, why is the chair moved? So changes were really, really hard for some of my people. And some of the patients who are really unwell, I felt were slipping through the cracks. The restriction and limited access to healthcare, I believe, was the biggest risk factor I've ever seen for my patients in my entire career. And I believe we're going to see the effects of this for decades to come. The messaging experienced by many, many people was, do not disturb the NHS as they don't have the resources to see you. I recall a patient telling me she tried calling the GP surgery, but the answer phone message frightened her so much she hung up because she was convinced the receptionist would shout at her for being selfish for wanting an appointment, as her condition was nowhere as serious as someone with COVID-19. We also saw a complete stop of medical monitoring in some areas. Blood investigation stopped, routine weighing stopped. And as a practitioner, I found this frightening. And if I'm frightened, it makes my ability to do my job more difficult because I'm constantly thinking about risk factors. This combined with working online, so not only to not being able to use my eyes properly to see if someone has lost weight, I found was really risky. One of my longer term patients, I feel, slipped through the cracks due to not being able or not feeling able to see a GP. She reported doing really well through the pandemic, whereas in reality was exercising more, restricting food more and more, and developed a number of destructive, obsessional tendencies as a method of self-soothing. I do believe if myself or the psychiatrist was able to see her face to face, or she was being weighed as she was being done previously, I'm convinced we would have picked up the fact she wasn't able to communicate she was struggling. This resulted in the need for an admission that I believe would have been avoided if we'd ensured patients deemed at risk were adequately cared for throughout 2020. And another serious concern I had in relation to limited access to healthcare was not being able to get patients admitted. Hospitals had reduced the amount of patients they could see due to social distancing, and this meant there were longer than usual waiting times, resulting in many patients who needed and deserved inpatient treatment being seen in the community. I also believe that even though the calls to the eating disorder charities are significantly up during the lockdown, there weren't the same level of referrals and assessments coming through. And we know that early intervention is key. And so we also know this opportunity was missed for many people, meaning those who developed an eating disorder or relapsed during 2020 will probably take longer to recover. The reduction in healthy strategies to regulate emotion, as we mentioned in the previous slide, meant some important protective factors suddenly stopped and were replaced with more destructive ones, such as binge eating or vomiting. And caregivers' anxiety. Caregivers' anxiety also reduced one of the strongest protective factors. As we all know, if mum and dad or the primary caregiver portray an image of coping, the child has a better chance of coping. If mum and dad are highly anxious and do not appear to be in control, then the child would often find any way possible to feel in control, even if that control is illusionary. Like the majority of the population, many parents were also struggling with their heightened levels of anxiety and were unable to hide this from their children. And many children reported to me feeling less able to talk to parents about their concerns or about their eating disorder, as they felt that mum and dad were already not coping and they didn't want to be a burden. And of course, the social isolation itself was a reduction in one of the most important protective factors, as they were forced to stay at home. And as Weira mentioned earlier, eating disorder sufferers already struggle greatly with this. And in addition, some of the aspects already mentioned, it's important to note that although many sufferers have a good relationship at home, others don't. And this meant for some being stuck in dysfunctional family system without a break, and that significantly increased the risk factors. So we can just go on to my final slide. Thank you. So I guess the purpose of my talk today is to highlight the fact that one-size-fits-all response when dealing with new situations like COVID-19 doesn't work fairly, because there will always be a minority group or groups that end up disproportionately disadvantaged. And we've just seen how this impacted those with eating disorders. I believe there needs to be a full review of the safety of lockdowns, taking into account all the risk factors for all the different groups. We saw that mental health took a back seat throughout last year, and we also know that so many physical issues were not seen as a priority. As eating disorders straddles both a physical and mental health issue, I do believe we need to ensure that if we're ever in a similar situation again, we provide more targeted care for the vulnerable rather than the one-size-fitting-all approach. And I'm also advocating that the use of increasing perceived levels of threat to change behaviours, or in other words, increasing levels of fear, isn't used in the future. Working with eating disorders, yes, we will explain the risks of behaviours such as food restriction or self-induced vomiting, but we don't deliberately increase their fear levels to make them change their behaviours. Instead, we try and understand why they've adopted the behaviour they're using. And this understanding helps them to own their own behaviour change. If we use fear, it usually always has negative repercussions and is dangerous. And I feel today we've just scratched the surface of some of the negative repercussions that those with eating disorders experienced, and the psychological advisors to the government warned about. I appreciate it's a difficult juggling act trying to get it right, especially when experiencing new situations. I just hope that researchers will spend time analysing our response to COVID and the impact of our responses upon all the different populations and groups, in order that if we're faced with another difficult new situation, we can make decisions learned from past experiences and look after those who need and deserve our care. So thank you everyone for listening to me today. Thank you.